We are due to start at 11:30 and we make it 11:30 on the dot, so we're going to get started. Just some housekeeping before I hand over to Victoria Rutter, who's the Executive Director for CPA. Please remain on mute. Please remain on mute when you're not talking. And you can have your video on or off, it doesn't matter so much. But certainly, whilst the presenters are speaking, it'll be really helpful to have to remain on mute. You can feel free to chat in the type in the chat box though, and we have our colleagues Sarah Kavanagh, who I think we have Sarah, but we certainly have Nikki on the line as well, who will be helping to respond to queries. So this is our third webinar for our COVID series from Commonwealth Pharmacists Association, and between Victoria Rutter and I will be chairing the discussion today, but we very much have several presenters on the line. We're so delighted to have them on with us today from Ghana, Uganda, Zambia, and we also have colleagues from Tanzania on the call as well, who will add in some further information towards the end. So I'm Diane Ashirodokwe. I'm a pharmacist by background, still a pharmacist, very much passionate about being a pharmacist, and I'm also the Global AMR lead for Commonwealth Pharmacists Association, in addition to my substantive role as a national lead for stewardship in England. Vicky?
Thanks, Diane. It's great to see you all. As I said in the chat box, it's great to have some old familiar names here and some new people join us, so welcome. I'm Victoria Rutter. I'm a pharmacist. I'm also the Executive Director of the Commonwealth Pharmacy Association, which we'll tell you a little bit more about in a moment. I've been in this role for about 4 years now, and we've developed the charity to do quite a lot of things now, which I'll tell you a bit about later. So shall we move on without further ado? So we've got a lot to get through. It's very exciting.
Yes, do feel free to tweet about what you're learning through the session using hashtag CPA COVID-19, but also hashtag CWPAMS. Over to continue, Vicky.
Okay, so just a brief run through of how we're going to schedule today. We've got an hour, we've got a lot to pack in, so we're going to have to be very strict with time frames for our presenters, and they've got a lot of exciting stuff to say. So they're going to be restricted to 10 minutes. So if we come in and cut them off, then just bear with us and do forgive us. So we're going to do a brief introduction to CPA and CWPAMS first. Then we're going to hand over to our 4 different projects to talk about their support during the COVID-19 pandemic, particularly, and then we'll save the Q&A session to the end with our panelists and just wrap up a little bit to tell you what's next. So CPA, as I said, we're a charity. Our vision is to empower pharmacists throughout the Commonwealth to improve health and well-being. And we do this in order to reduce health inequalities, mortality and morbidity, and improve quality of life, creating healthy communities. So next slide, please, Diane. This is our mission here. So improving access to quality medicines and reducing health inequalities, managing the safe and effective use of medicines to improve health outcomes, and improving health literacy and promoting healthier lifestyles. And all of this is really to achieve these sustainable development goals, but in particular SDG number 3, which I don't know, many of you may be familiar with this, improving health and well-being for all. And we will do this obviously working through the pharmacy profession, developing essential health systems and services, and also improving access to essential medicines, vaccines, diagnostics and devices. So next slide, please. So our approach here is to work collaboratively, obviously, to deliver our mission. And we work together with member organisations who are the National Pharmacy Associations throughout the Commonwealth and policymakers. And to deliver our vision, we develop networks, resources and opportunities. And really that's to create practice and educational resources, knowledge and skills exchange and advocacy and campaigns in order to strengthen the pharmacy profession and really improve access and quality use of medicines to achieve the end goal here, which you can see. So here are a few of our core activities, just briefly. Many of you may be familiar with PharmAid, PharmAid is a scheme where we collect the recently outdated British national formularies from the NHS hospitals every year and deliver them to our national pharmacy associations according to their requests. And that's been going for a long time, since about the 70s. We also host joint conferences with our national pharmacy associations to help strengthen the profession within those countries, and also to help prioritise some of the discussions and issues they may have in country. Our next conference was planned for Kigali in Rwanda later this year, but because of COVID, we're delaying that till 2021. So keep your ears out, and hopefully some of you can join us on that. We have a educational offering that we're developing at the moment and talking to our national pharmacy associations about their CPD needs in particular. But there's more coming in terms of that later on. And we're also actively involved in campaigns. So we do the Fight the Fakes campaign, and we're also very much involved in World Antibiotic Awareness Week and Antibiotic Guardian campaign, where we provide materials for our national pharmacy associations to help them run their own campaigns, but also use some of those kind of high priority issues to help advocate for the role of the profession within the Commonwealth and within health systems. So we have a lot of advocacy opportunities throughout the Commonwealth because of our position, and we have been presenting some of this work to Commonwealth health ministers over the last year, so they're aware of the CWPAMS programmes and the role of pharmacy there. Here's just a few pictures from around the Commonwealth illustrating the COVID-19 response. And really, you know, this global pandemic is the defining global health crisis of our time. And this is just a kind of thank you to our pharmacists and a recognition for their tireless work. And we're going to hear more about that now regarding how our CWPAMS partnerships have responded to COVID-19 at this time. So, Diane, I hand over to you now. Thank you.
Thank you, Vicky. So over the next few slides, I'm going to just go through very briefly what the CWPAMS project is. So CWPAMS stands for Commonwealth Partnerships for Antimicrobial Stewardship. And it's a Fleming Fund, a UK aid fund through the Fleming Fund, and TETH, which is a Tropical Health Education Trust, and Commonwealth and CPA have been responsible for developing the program. TETH are the fund managers, but CPA providing the technical leadership for CWPAMS. And there were 3 intended outcomes from CWPAMS, which is around institutions and workforce, demonstrating improved knowledge and practice related to antimicrobial stewardship, prescribing and infection prevention and control, developing evidence for effective stewardship and AMR interventions with standardized tools and guidance being used at local institutions and or by national partners, and then NHS staff demonstrating improved leadership skills and a better understanding of the global context of AMR in their work. There were 12, after a competitive process, there were 12 partnerships grants awarded, and we use a health partnerships approach, which is between UK, but also colleagues across the 4 countries, Ghana, Uganda, Tanzania, and Zambia. And you can see here the 12 partnerships. You can see we have 5 partnerships in Ghana, 1 in Tanzania, 5 in Uganda, and 1 in Zambia. The Zambia and the Tanzania partnerships, as well as the Uganda partnerships, were all existing partnerships which built on but had never worked on stewardship before. So they were bringing in new partners, but also building on their existing relationships. Whereas all the 5 Ghana partnerships were all completely new partnerships that formed as a result of CWPAMS. So really good to see that happening. We've got some really good outputs from CWPAMS. We're now 18 months, almost 2 years into it. We've had challenges with COVID, as has everyone else. And so there was a period of time where activities paused, but nevertheless, there were several outputs and outcomes already achieved prior to COVID, and they've continued to work through the process, as you will see through the presentations by our colleagues. Key ones has been training. So we've used train the trainer approach and also behavior change strategies. We've developed standardized checklists and behavioral tools that have been used. The global point prevalence survey was a key one. And for example, 2,000 bed Kolibu Hospital having the global PPS carried out across their massive massive hospital. And then we also developed an app which included the national treatment guidelines, WHO guidelines, infection prevention and control surveillance guidelines. And as you'll see, we were able to adapt that for COVID guidelines as well as COVID happened. One of the amazing parts for me for CW PAMS is the development of the fellowship. And we now have 16 pharmacists for the first time. We have global health pharmacy fellows, UK based, but they were the pharmacists who were supporting or leading aspects of the CW PAMS projects. And all 16 of them are on this slide here, as you can see. And out of the 16 of them, several of them are presenting today. Claire, Edwin, B, Kate and Reem are presenting today, but all the others have had such a massive impact within their partnerships, and I'm really excited they'll be having their end of fellowship event in September, and we're really excited to hear what they will and what they have gained and what they've shared and learned through their fellowship projects.
And Fiona, Diane.
And Fiona, I'm so sorry, and Fiona. I was looking on and thinking, what have I missed? And Fiona, thank you. Social media has been quite important for us, and we have, and what's been really good about CW PAMS is that because of the use of social media, so many different individuals who would never really have understood or seen the impact of this are now aware of the of stewardship, but also of the support that has of the partnerships that have developed, and also the bi-directional learning, because what we're learning a lot from our colleagues is that they've learned so much from going to Ghana, Uganda, Tanzania, and Zambia, and it has certainly been really impactful in how they have handled COVID. As CPA, we've also responded to needs for COVID as an organization. We carried out a needs assessment earlier on, and because of that, we've developed a range of tools. And these webinars is in direct response to the survey results. We've developed a community of support on Telegram, and we've also been signposting to COVID information over time. We also use, in collaboration with the Brighton Lusaka link and sponsored by the Commonwealth Secretariat, we were able to develop a training video on developing local production of the alcohol hand drop, which is a WHO formulation. And finally, I talked about the app earlier. We were able to update the app to include COVID guidelines from both WHO, FIP, which is the International Pharmacy Federation, but also national guidelines on COVID where they exist within the 5 countries. So our presenters today, as you can see, we have so many presenters today. We're really excited to have them all with us. It does mean that we have to be very strict with time, and Victoria and I are already running out of time. I've already run out of our time, so I'm going to move on very quickly now to start with. I know Reem has got a bit of challenge with her colleague. I don't know if Ronald is now online, Reem, but we've put this in order just so that we can get through the slides. So Reem, is Ronald here? You need to go off mute, please. You're on mute.
I haven't been able to make contact with Ronald. I'm not sure if there are any internet issues. Ronald, if you're around, can you let us know?
Okay. Would you like to carry on?
I'm gonna have to.
Challenges of virtual meetings.
Over to you, Reem.
Yes, okay, thank you. Thank you for inviting us to share our experiences. The CW PAMS project builds on an established partnership between Cambridge and the Department of Obstetrics and Gynecology at Makerere University, going back over 10 years. The goal of the project is to introduce reduce healthcare associated infections on the obstetrics and neonatal wards at Kawempe National Referral Hospital and Malago Specialised Women and Neonatal Hospital through increased skills, knowledge, and understanding of antimicrobial stewardship and infection control. In September 2019, a multidisciplinary team of doctors, nurses, behavioural scientists, pharmacists, and even a pharmacy technician from Cambridge delivered a training course in Uganda. And in November, Cambridge hosted a team from Uganda who attended antimicrobial stewardship rounds and infection control activities, among other things. As a result of these activities, clear antibiotic guidelines were developed, pharmacists are increasingly empowered, and a medicines therapeutics committee was formed. So we're just going to start at the beginning. If we cast our minds back to the time when Uganda first reported its first positive coronavirus case, there was a lot of feeling of anxiety and concern about how to manage these situations. Cambridge we were able to help because we had actually had the first cases well before it had reached Africa, and were able to share some of our experiences. So some of the team as part of the partnership reached out to our doctors, and we've had a couple of text exchanges as well through the pharmacists, just asking about how we're managing our COVID response, and really just to glean any sort of information as to help the partnership prepare for what's coming. I remember receiving lots of emails, and we arranged also quite a few Zoom calls, and that's still ongoing, which were supported by the Cambridge Global Health Partnerships. And we also put through a THET Health Worker Action Fund grant, and that's given us a little bit more support in terms of the purchase of scrubs, concentrated alcohol gel, and we're also sharing lots of guidelines and other things. Sorry, I'm just going through my list. So really being able to share protocols, guidelines, poster templates from our growing repository, I think has really helped give our partners the confidence that they needed to prepare for what was coming. And as a result of the CWPAMS, Ronald had already gone out to Ginger Hospital to learn how to manufacture alcohol gel on a larger scale. And that's helped reduce costs for the hospital as well. It's also ensured that alcohol gel has been more widely available. The CWPAMS project supported the purchase of the alcohol dispensers, and I think there might be some pictures somewhere there, Diane, of some of our alcohol gel. Thank you. And it's really through the hand hygiene awareness that we were raising as part of the infection control that we've helped to try and give people the confidence that they will be protected if they clean their hands and are and also with the scrubs, that they weren't going to be transmitting that back home, and also the procurement of PPE. I think this partnership has also helped us to helped us gain a lot of new skills on both sides. I know from some of the bi-directional learning, as you mentioned, Diane, it really has been very helpful also from our part. So we've certainly gained a better appreciation of some of the daily hurdles and experiences by the healthcare workers in low middle income countries, particularly around managing shortages, unavailability or low availability of laboratory tests and vaccines. And that's certainly been very prominent with COVID as we're waiting for test results to become available, turnaround time of test results. We're still awaiting vaccines, and it's brought it really home for us about how other people are managing to deal with all of these issues on a regular basis. I remember having daily meetings about PPE and listening to updates in high-level board meetings about, intensive care, ventilators, making those available, etc. And I just feel like the CW PAMS has just taught us the importance of being adaptable, and that not all plans come to fruition. We've all had to keep up with the fast pace at which the situation with the coronavirus changes on a weekly, sometimes on a daily basis. We've also learned how important it is to be open to ideas and accept the opinions of others, even if they're different to our own. During the pandemic planning stages, quite a few of us were reporting to very senior managers and administrators in the hospital, people who we wouldn't normally interact with. And the partnership certainly helped consolidate our knowledge, gave us the confidence to share our opinions and to know that our opinions really do matter. And best of all, the partnership has brought people together that wouldn't otherwise have met. I'm not just talking about our friends in Uganda. Even within our own Cambridge team, we've gotten to know colleagues on a personal level. And this has strengthened our relationships even within our own organisation. We've even set up a WhatsApp group to keep in touch and help each other with queries. We also feel very closely connected with our Ugandan colleagues and friends, and we've formed a bond with them that will last well beyond COVID and CW PAMS. How's my timekeeping?
Very good.
Perfect, I think spot on.
Yes, I don't know what else to add really. That you've seen the information about the alcohol gel on the slides. I mean, I think that's really been key to just giving the pharmacists something to be able to give back. Ronald has mentioned to me that he has put himself forward to be on call 7 days a week out of his own initiative. And he deals with any little emergencies and makes sure that there's sufficient alcohol gel. So he'll go in on a Sunday and make sure if they've, he mentioned that there was somebody admitted from Afghanistan once, and there was a lot of concern about potential COVID. And he went in to make sure that there was enough alcohol gel available, there was enough PPE for the staff. And I think that sense of responsibility has really been born out of CW PAMS and the cross-working relationship between the two teams. So, yeah.
Thank you. Okay. Great. There'll be questions for you later, I'm sure. Over to you, Vicky.
Thanks, Reen. That was really interesting. It's great to see, especially how the IPC, the infection prevention control aspects, have, really impacted in terms of the COVID-19 response, especially. So thank you for that. And we're going to hand over to Nottingham Trent, Buckinghamshire Healthcare NHS Trust and Macquarie University Partnership next. So B and Freddie, are you there?
It's Kate and Freddie, actually.
Sorry.
It's all right, don't worry. So I'm Kate. I'm an infectious diseases pharmacist at Buckinghamshire Healthcare NHS Trust. And as Diane's also mentioned, I'm also one of the fellows. And I'm honoured to be presenting today with Dr. Freddie Katutu, who's the Dean of Mckeon University School of Health Sciences, and also Ugandan Pharmacist of the Year Research Category 2017. I just want to introduce the UK partners. From the big photograph on the screen, on the left-hand side is Dr. Jodie Winter, who's the microbiologist at Nottingham Trent University. Next to her is Claire Brandish, the lead antimicrobial pharmacist at Buckinghamshire Healthcare NHS Trust, who is also on this call. Dr. Gina Driscoll, who's the microbiologist here at Buckinghamshire Healthcare NHS Trust. Myself, and then Senior Antimicrobial Pharmacist at BHT. And standing next to B is Dr. Linda Gibson, who's the lead partner for the UK side of the project, and she's a public health professor at NTU. In addition, our partnership involved a One Health approach. So we also have Saba Amir, who's a veterinary researcher at Nottingham Trent University. And I'd like to hand over to Dr. Freddie Katutu to introduce the Ugandan partnership.
Thank you very much, Katie. I'm very privileged to present our work, and I will continue with the introductions. Right next to Linda Gibson on your right is Dr. Musoke David, who is the lead of the partnership at the School of Public Health at Makerere. And then we have Ismail Musoke right between Claire and Jean, the pharmacist at Entebbe Hospital. That was the beneficiary of this particular partnership. And then go around, starting from the bottom left. So it's Freddie Kitutu squatting, and then Grace Binzika, who was the project coordinator, and then Saul Balikuna in Botai, one of the pharmacists' colleague, and then Professor Lawrence Mugisha, who is a veterinary doctor and also a member of the team. As far as our project was concerned, the objective was to strengthen antimicrobial stewardship in Wakiso district, which is the district right around Entebbe International Airport. And the reason I mentioned this is that the hospital, Entebbe Hospital, was one of the first response hospitals to the COVID pandemic, given its vicinity to the airport, as our initial cases were cases that were flying in from Dubai and the rest of the world. So Entebbe Hospital was the first to treat some of the cases that were reported. The rest of the objectives, as Katie mentioned, was a One Health project where we looked at access to antibiotics in the community, but we also did a lot of work at Entebbe Hospital in strengthening antimicrobial stewardship and setting up the Medicines and Therapeutics Committee. Next slide, please. This slide shows us the means, some of the implements we used. You see the WHO competence framework that formed the basis of a lot of our activities, assessing knowledge and practice and attitudes of the health workers. You see the Uganda clinical guidelines, that was the tool for reference in terms of teaching the health workers to use treatment guidelines in their treatments. Then, of course, the COM-B framework that CW PAMS had set out for the projects. We had a lot of group discussions in our training, and the training aimed to improve ability by looking at knowledge, skills, but also adapting adult learning methods. Next slide, please. This is just a sneak preview, pictures from our activities. Activities that involved the visit from the team from Buckinghamshire. So Claire, B, Kate, Jody, all came to Uganda. Some of them came twice and participated in the community activities, in the hospital activities, in the training of the health workers, as you see. We also had awareness in the primary school, but also teaching them how to wash their hands in the lens of infection prevention and control. And we learned a lot through the interaction, but also passed on a lot of capacity to the hospital and to the different communities we interacted with. I will invite Katie back to take us through the remaining slides.
Okay, Diane, next slide, please. So we conducted a survey after the workshops, and this is just a snippet of some of the results. But it was really reassuring that 91% of the participants have adopted new practices after the training, particularly improved hand washing, which obviously we didn't know at the time, but with COVID, that's imperative. There were also challenges faced, so drug stockouts, still a lack of prescribing materials, lack of hand washing facilities, and also a lack of PPE. Next slide, please. So what did we do to address these challenges? So the drug stockouts, as Dr. Katutu has stated, there was the formation of the Medicines and Therapeutics Committee at Entebbe Regional Referral Hospital, and Antimicrobial Stewardship was a subgroup of that. With the lack of prescribing guidelines, during the workshop we did introduce the CW PAMS app, which was very well received actually, and we encouraged delegates to download the app, and then we used it during the workshops. There was also there was a scoping visit in April, and it became very apparent that with community health workers, because our project was very much a train the trainer approach, with the ultimate aim of training community health workers in the field, that there was a lack of hand washing facilities. So we came up with the idea of raising some money separate to the project, using crowdfunding, which is something we'd never done before. But this was really, I believe, successful, because we raised about £500, and it was enabled to deliver hand washing resources, which you can see in the picture, to Zinga and Busi Islands. And I actually this morning received a really nice feedback from the community health worker coordinator, saying that these hand washing facilities were bought just at the right time before COVID-19 in Uganda. During this time, we're continuing to put them in public places to be used by community members. So that's really, really lovely to hear. And at this point, I'd like to mention Philemon and Grace, and Dr. David Masuki, have been instrumental in making sure that these hand washing facilities have been delivered to the islands. So thank you very much. Next slide, please. So just to continue, so a survey was conducted among the community health workers after they had their training. So again, this is really important, and these are just a few of the results that we've had. But the interesting things just to pick out of this slide is 81% increased hand washing with soap. Also, something that was really interesting for us as well was 31% of participants have discussed AMS with between 50 to 100 people in their community. It became very clear in the scoping visit that community health workers are really well respected in their community, and they're real excellent resources to deliver the health promotion messages. So it was great that we were able to supply hand washing facilities to this cohort of community health workers. Next slide, thank you. So how did the partnership support COVID-19 response? So I think it was really timely. How did anyone know that we were going to train people on IPC? We used the glow germ experiment in workshops and at the schools. So that message was reached out to the healthcare practitioners and the wider community. Dr. Ismail Kazitu, the pharmacist at Entebbe Regional Referral Hospital, he learned how to manufacture alcohol hand rub using the raw materials as part of the project. And I think the Medicines and Therapeutics Committee formation has been really instrumental in helping to draft rapid treatment protocols and SOPs for the emergency COVID-19 response in Entebbe Hospital. We're in the process of drafting an application for the THET Health Workers Action Fund. And on a personal note, myself, Claire and Bea have all been redeployed during COVID-19, and we've been moved away from our normal day jobs into intensive care unit. And it's been lovely, really lovely, seeing the updates from the partnership with maintaining communication. So WhatsApp messages, we've still had regular Skype calls, and it's just been great. We've also got a online community of practice, which has been active in sharing resources. So there's one for students and there's also one for healthcare workers. So we've just been sharing some resources on that. And Freddie, I think probably, would you like to summarise from your point of view as well?
Yes, thank you very much, Kate. I'll just take a minute to thank Kate and the team from BHG and all the institutions in the partnership for the great work that we continue to do. I'll also take 1 minute to mention the second partnership for which I'm part. That's the partnership with the London School and University College London. Rich Penasai is online. I'd just like to say that we work together as well to improve antimicrobial stewardship interventions at Ginger Hospital. Similar activities as those we've talked about in Entebbe Hospital, and Ginger Hospital is also one of the regional referrals that has been earmarked to manage COVID patients. It has managed the number already, and capacity has been strengthened over the last 3 months for any surge in cases who require additional specialized treatment. I'll end here for now, and we'll be happy to take questions. Thank you very much for the opportunity to share our work, and to the team at BHT and UK partners for the great partnership. Over to Vicky.
Thank you. Thank you very much, Kate and Freddie, and to the rest of the team as well. People have been asking questions in the chat box, so please feel free to reply to them, and we'll have an opportunity at the end as well. So we're just going to move on now to the Brighton and Lusaka team, and I'm going to hand over to Fiona, and I think it's Aubrey as well who's presenting with Fiona. Over to you both.
Hello everyone, and thank you very much for inviting us to talk about our experiences of CPAMs on COVID-19 via the Brighton Lusaka Health Link. As Dan just said, my name's Fiona Rees, and I'm a highly specialised pharmacist at Brighton and Sussex University Hospitals, specialising in gastroenterology, but I'm also one of the Global Health Fellows. And with me today, I'm very lucky to have two of my wonderful Zambian colleagues. I have Patrick, who's the pharmacy lead for alcohol handler production at University Teaching Hospital based in Lusaka, Zambia. And then we have Aubrey as well, who is a Rhodes Scholar and Special Research Fellow at the University of Zambia and has strong links with UTH, the hospital, and has been part of the fellowship as well. So as was mentioned in regards to the beginning of what the CPAMS project was, it was very much to develop a proactive and dynamic antimicrobial stewardship program within UTH, but also about that bi-directional learning. And in doing this, we thought we'd follow the WHO competency framework that really has the 4 pillars. And today we're mainly going to be discussing IPC, but other bits as well. Next slide, please. One of the first tasks we did with regards to the project was setting up a 3-day Train the Trainers workshop, which was held in June 2019, which seems a long time ago now. But it was an excellent workshop and had really excellent engagement from a wide range of people, not only just within the hospitals, including pharmacists, doctors, nurses, but also our sister hospital colleagues from there, which is in Ndola, which has really kind of fostered collaborative working between Zambian hospitals, which we'll talk about later. But also we had representatives from the Zambian Ministry of Health, from THET, from the Hospital Pharmacist Association of Zambia, from the University of Zambia, and from the Zambian Medicines Regulatory Authority. So really trying to ensure sustainability and engagement from the beginning. Within this workshop, there were 23 trainers trained, and facilitators from the day were not just from Brighton, but also from UTH and Ndola. And we really just shared the current landscape of antimicrobial resistance across both countries, and then strategies for development for AMS and how we could provide a workable solution in UTH and, as I said, bi-directional learning in Brighton. The feedback from the workshop was very good, with 74% reporting strongly agreeing on the outcomes and 19% on agree. Next slide, and I'll now hand over to my colleague Aubrey to discuss regards AMS pharmacists and future developments.
Hi, thank you so much, Fiona, for that, and thank you for the opportunity to share. So part of our work at CWPAMS in Zambia was to realize firsthand what are the components that we needed to make AMS work. And I think we realized earlier on that championing pharmacists to take up AMS roles would require leadership. So in that way, we realized leadership was required on clinical care settings, particularly in the hospital. So for the first time in Zambia through this project, we were able to initiate and lobby for a position of a pharmacist who can be an antimicrobial stewardship pharmacist. I think that's the model we adopted from the UK partners at Brighton. We're able to see that having pharmacists who are dedicated for the role and the capacity built do have a particular roles to play and are able to influence prescribing and other aspects of AMS in the clinical care settings. So I'm happy to report that at UTH for the first time, we have a pharmacist, female pharmacist for that matter, who was given that role with the help of the project. And I think so far it is working quite well, and we're having the role quite recognized, even on the Medicine Therapeutics Committee. So we're happy also to see that some of the work that the project is initiating can be led by particular individuals that are appointed to do the clinical work. And a lot of other aspects that we have done is to link up the antimicrobial stewardship pharmacists and other pharmacists who are playing these roles to the Brighton colleagues to be able to share best practices, share tools and other audit aspects that can be used in the clinical areas. Guidelines are also being developed for microbial prescribing at UTH. Part of this work is also being collaborated with the University of Maryland and the Brighton Sussex University Hospital. So it's work in progress, but we're hoping that the guidelines will be rolled out pretty quickly, especially now during this period. Next slide, please. Yeah, so this slide, we just wanted to highlight some of the interventions that we're also trying to roll out. We've tried to bring up aspects of improving prescribing through this project, and what we developed and adapted was an antimicrobial stewardship prescribing chart, which through the work of pharmacists, we're trying to also have this chart piloted in, currently we're doing it in the ICU to see how prescribing changes can be implemented. So as we speak, we've managed to do a pilot, and we're currently just reporting on the findings, based on the perceptions of the prescribers to use modified tools for prescribing. And we're following up also now to see what type of outcomes it's having, whether it's changing prescriber behavior, whether it's also changing patient outcomes in terms of drug choice for antibiotics, dosing, and follow-up care. So this is one of the interventions that we have successfully tried to develop, and now we're in the process of piloting and implementing, hopefully with positive outcomes. Next slide, please. Other aspects that we want to talk about, which the project is helping to do, is around behavioral change aspects, because we realize that in Zambia, the clinical practice around the clinical care settings has been mostly very traditional. So also trying to think about bring about behavioral change aspect when it comes to dress code, which is more promoting infection prevention and control, because we do realize that some of the hospital-acquired infections are actually transmitted by the healthcare workers themselves. Aspects to do with attire, hand washing, and all these other things that we've talked about earlier in other presentations. But here in Zambia, we're trying to roll out the Bear Below the Elbow initiative. I think this is the first as well. Working with the professional associations, the Hospital Pharmacists Association of Zambia and the Medical Association of Zambia to see how they can try to adapt a Bear Below the Elbow dress codes. It's a process that we're trying to see whether also it can be rolled out to other institutions. So we're in the process of seeing how it can work out at the University Teaching Hospital where the project is housed. But with successful outputs, we can see how we can roll it out to, with the help of the associations, to see whether we can lobby for a behavioral change aspect when it comes to dress code. So other aspects also is to see what outcomes it can have in terms of preventing or reducing infections. So with a modified dress code, what will be the outputs to see on the infection rates and so forth compared to when the dress code was different. We did conduct a trainer of trainers on IPC. We trained colleagues from the University Teaching Hospital who are pharmacists, medical doctors. There were also environmental health personnel there. And this work was led, of course, as Fiona said, with the help of the Ndola team, which have quite a huge experience with conducting IPC trainings. We were able to share best experiences and practices, and the capacity built the colleagues at UTH to be able to conduct infection prevention through hand washing, and also a demonstration using the globe boxes and the posters. Developed quite a number of posters which have been stuck around the hospital settings, particularly at UTH, and also the other partner hospitals that are starting to come on board this project. This is quite a good output as well. I'll hand over to Patrick to speak about the hand rub production. Is Patrick here? Okay. Nonetheless, so one of the other aspects we've done and enhanced is to do hand rub production in the hospital settings. On this slide, you can see pharmacists being trained by our colleagues from Undola and UTH and spread around the other 5 teaching hospitals, which are in Zambia, in the different parts of the country. So we're able to produce WHO recommended alcohol hand rub using prescribed formulas, and are able to now use some of this in the hospital settings to prevent the COVID-19. And a lot of this work is still ongoing. We are in the aspects of also just monitoring and auditing how much hand rub is being produced, and whether the initiative can also be sustained and picked up by the Ministry of Health. So the project has initiated, and we're happy to see that Zambian hospitals are able to produce their own hand rub as compared to procuring already made products. So Fiona can speak about this. Thank you.
It was just briefly to mention that when we were looking around for IPC posters, trying to use either what templates we have here in the UK or anything globally, we couldn't find anything that was particularly African sensitive and so would be straightly applicable to Zambia. And so on talking with our colleagues in Zambia, we felt it was better to develop our own one. So we gratefully got some pictures of the staff using the hand rub we're producing, also the aspect of bare below the elbows, and also integrating the 5 points of care. And we developed these posters, and these are some of the posters that have been produced throughout the hospital in UTH and now being used in the other hospitals.
That's great. Thanks, Fiona and Aubrey and Patrick. I think you were online, weren't you? Is there any more to follow? Because we, just for the sake of time, we're going to have to hurry on now to the Ghana partnership. Had you finished, or is there any last comments that you wanted to make?
No, the other comments were just kind of next steps, so that's fine.
Fantastic. Right, brilliant. So we'll save questions to the end. And without further ado, we're going to hand over to Yvonne, who is our counsellor for Ghana, and she's also been involved in the partnerships there in many different capacities. And I think Edwin's going to present with her, who's one of our fellows, or certainly have an input into that. So Yvonne, I hand over to you now.
And Yvonne,
thank you very much.
Yvonne and Edwin, I'm going to move through the slides quite promptly.
Okay. Thank you very much. My name is Yvonne Yuenjo. I'm counselor for CPA for Pharmaceutical Society of Ghana. I'm a pharmacologist, and I'm also the director of the Ghana College of Pharmacists. But on the THET project, I was also the country coordinator for THET, for the CW PAMS. And so we do not have the luxury of other bodies or other presenters, because we are presenting for 5. And Edwin will present for LECMA, which he was directly involved in, as well as for Kolebu Teaching Hospital. So I'll give a few introductory statements. Please, let's go to the next slide. Yes, so the project in Ghana was based, or was directly linked to, our National Action Plan on Antimicrobial Resistance. Next slide, please. And when you look at our strategies, you see that there are some from which we drew, the project drew guidance. So for instance, our strategic objectives ensured that some of the things that were really critical for CW PAMS, for antimicrobial stewardship, were also applicable, were also being implemented in Ghana. So everything really was in alignment with the National Action Plan. Please, let's go on. Yes. So with our partnerships, we have partnerships across the country from Saboba in the northern region to Ho on the eastern part of Ghana. And then in Accra, we have the Kolebu Teaching Hospital, the police hospital in Ghana, and the Lekma Hospital. But Lekma Hospital was working together with the Ghana Public Health Association. So these are the partnerships. And we also had Keta Municipal Hospital in the eastern part. The partnerships in Ghana, Kolebu partnered with the North Middlesex University Hospital NHS Trust, and they worked, so I'll just give you the partnerships for the sake of time. Assemblies of God Hospital in Saboba worked with Norfolk and Suffolk NHS Foundation Trust. The Ghana Public Health Association, which did their implementation in the Lekma Hospital, worked with the UK Faculty of Public Health. The Ghana Police Hospital, which is in Accra, and Keta Municipal Hospital, which is in Keta in the eastern part of Ghana, worked with the Health Improvement Scotland. And the University of Health and Allied Sciences, which also did their implementation in the whole teaching hospital, worked with the University College London Hospitals NHS Trust. So Edwin, if you can just take it for Kolebu.
Yeah. So Kolebu and North Middlesex University, where NHS Trust worked together to implement professional capacity and sustainability of AMS and IPC programs. And one of the biggest achievement for them was getting the global PPS done on a 2,000 bed, what I'll call a village. Kolebu is quite huge. So getting that done was a huge achievement for them. And from speaking to colleagues there with regards to COVID, especially the IPC training that they had has made a huge impact and made a huge difference to how they responded to COVID. Next slide, please. Yvonne, this one is yours.
Yeah, Assemblies of God worked with the Norfolk and Suffolk Foundation, NHS Foundation Trust. And the next slide, they looked at optimizing the use of antibiotics and increasing knowledge in antimicrobial resistance in a rural healthcare setting in northern Ghana and the wider community. Now with COVID-19, what has happened is that their clinical coordinator is now working with the district COVID-19 team. And during the CW PAMS project, quite a number of inroads were made in the community. And these inroads have been utilized to in the fight against COVID-19. There is currently ongoing community sensitization on the need to use the proper protocols, to utilize proper protocols which have been implemented. And they are also developing songs in the local languages for the various areas which are targeted at COVID-19. Now, these tools were used earlier on when they were implementing the CW PAMS. So these are the local team, local team members, and these are some of their pictures. I am sure that for those who have been to Ghana, FET partners will recognize some of these people. Edwin.
Yeah. So my project was actually with the Ghana Public Health Association and Faculty of Public Health UK and in Lekma. And our aim was to strengthen the AMS through improving surveillance, as well as building sustainable capacity in Lekma Hospital. The volunteer delivery service in Ghana has had quite a few people that have inputted within the Ghana Public Health Association. So Dr. Amofa, who is now the head, has been recalled to support the national response. Dr. Kome, who's also based at Lekma Hospital, is now part of the case management team. Dr. Minal is also now part of the response team for the metropolitan area. James Anwar Mckeon is the secretary for the Ghana Public Health Association. He's now volunteered to, for the UK side of it, Ghana's version of the Nightingale, and Professor Fari supports the national surveillance for the data management. LECMA is also a treatment center for mild cases and almost triaging in most cases as well, and has been quite collaborative on managing COVID response and strengthening of collaboration amongst practitioners in Ghana, as well as case management due to its expertise. Next slide, please. Yeah, and this is a picture of the group. Picture of the group, and in the middle is Dr. Amofa, who's, like I said, now dealing with COVID particularly. And James is somewhere in the pictures on the left, and my team from the UK are all on the right-hand side. Next slide, please. Yeah.
Right. So the Ghana Police Hospital and the Keta Municipal Hospital worked with the Healthcare Improvement Scotland in utilizing a Scottish triad approach to developing and implementing AMS in Ghana. Now, some of the things that have happened which have been positive towards COVID-19 management is an improved adherence to the standard treatment guidelines to reduce unnecessary use of broad spectrum antibiotics. And of course, since the main symptoms of COVID-19 are respiratory in nature, at least the ones that are very easily recognizable are respiratory in nature, this has become very important. There has also been an enhancement for the need to test before treating suspected infection cases. And with the program, what has happened is that there has been an improved collaboration among staff members. Also, staff members have been educated against indiscriminate prescribing of antibiotics where there are suspected cases. And of course, this is critical in COVID-19. And the team members have been recruited currently on the selection and procurement of recommended drugs for the management of COVID-19, which is a real big plus. Next slide, please. Yes, so these are some pictures of team members, both UK and Ghana. The University of Health and Allied Sciences in Hull with the Hull Teaching Hospital also collaborated with the University College London Hospitals NHS Foundation Trust with the aim of building capacity with, can I have the next slide, please? Building capacity and enhancing the hospital pharmacist's role in the stewardship of antimicrobial agents. Now, what has happened, which has been very beneficial to COVID-19, is the improved collaboration and teamwork among practitioners. So with their team, because they put together a big team across healthcare practitioners, building on that for COVID-19 has been very successful. Also, there is improved data collection skills, which of course was one of the things that came up with the global PPS surveillance. Yeah. So this has been very, very beneficial. And there has been an improved ability to adapt to and work in different settings. And this has been particularly beneficial as members have had to move into different areas and change the ways in which they work during this COVID-19 era. Next slide, please. I'm sorry, the slide before. IPC training has also equipped the staff with the knowledge of the importance of PPEs and skills on how to wear them and use them. And of course, because some links and inroads had been made among staff during the CW PAMS, it was very beneficial and it could be built upon. And the hand hygiene skills have also become very, very important during the pandemic. And the next slide shows you the pictures, a big picture of the very big team that participated in this project. Well, the project is still ongoing, even though it's been suspended because of COVID-19. Next slide, please. So in short, CWPAMS has been a good preparation for the management of COVID-19, and the timing could not have been better. Thank you.
Thanks, Yvonne. That was really interesting, and I'm really super impressed that you got through those slides.
In just over 10 minutes. I'm impressed. Well done, and Edwin too.
Thank you.
Thank you.
So I think we've had quite a few questions coming through on the chat that hopefully we've been responding to, and obviously we can take questions via the email address that we gave you at the start as well. Diane, do you want to say anything else at this point?
Yeah, I think we've been able to answer most of the questions, but I wondered if our colleagues from Tanzania wanted to share anything very quickly. So Scott and Joe, if you've got 1 or 2 minutes, do please keep asking questions within the chat box. And if there's anyone that's got anything in particular they feel they need to ask verbally, please do just raise your hand and we'll come to you. But Scott and Joe, if you want to just go off mute.
Yeah. So I think part of the really interesting learning from our project is some of the spin-offs that we hadn't really planned on that then sort of happened. So one of the fantastic ones was as part of the visit for the pharmacy team and infectious disease team coming to the UK and coming to Northumbria was they were seeing how our clinical pharmacy worked on our ward environment. And they really wanted to emulate that when on their return to KCMC. So part of our visit to Tanzania, to the hospital, was to show them some of the beginning steps for developing a clinical pharmacy team. And that's now in place on the medical wards. And that's such a strong interventional tool to actually improve things like AMS, but also other areas of clinical pharmacy at the same time. Joe, do you want to mention something?
Yeah, so sort of with regards to that, so when we were there, we ran a series of sort of small workshops around like the skills and the tools that you can use on the wards and making interventions and challenging professional colleagues and that sort of thing. And it was really well received, and they're putting it into practice. We've had feedback from our partners to say they are still participating in medical ward rounds. They're wanting to build on it more. So it was really something we are hoping to take forwards and build upon the work we started, and see where we can go with that to develop the service a little bit.
The only other thing is, was an interesting spin-off, was one of our educational pharmacists from KCMC got invited to a national AMS in Tanzania group to actually talk about the work that we've been doing. And following on from that, she's now chair of that group. So she's now got a huge influential position as a pharmacist in that area, which is actually absolutely wonderful. So, yeah. And well done to her for actually getting that opportunity.
And the only other thing to mention, just to sort of build on what our colleagues have been saying, is we introduced a AMS module into the training program for the Kilimanjaro School of Pharmacy and into the Newcastle University School of Pharmacy. So it's the same module which was co-developed between the two schools and is being delivered at both sites, which is just a great sort of long-standing legacy of the project and something that will be taken forwards into future generations.
That's amazing. Thank you both so much. Have we got any, Vicky or Nikki, anyone wanting specifically to, thank you both very much. That's really helpful to have a viewpoint from that, and particularly the impact on clinical pharmacy that we are really seeing across the countries as well, which is an unintended consequences or planned consequences in a way, for us, really encouraging and supporting and developing the role of pharmacy across Commonwealth countries is something that CPA is passionate about. So we're really grateful to see this impact coming through as a result of CWPAMS as well. So thank you. I cannot see any particular questions or anyone. Someone was raising their hands during the talk. I don't know if that's been addressed, but we'll just give one more minute if anyone wants to raise their hand. You can do that through the panel that you have, and then we'll take the questions from there, and then we will end the webinar, because I think we are just a few minutes over our time now, 4 minutes over.
Yeah, we've got one raised hand with Simon Bolan. Did you want to say something?
You want to unmute yourself?
No.
Okay,
any other questions from the floor?
So we've got Junior, who's saying congratulations to all involved. Thank you very much. Junior, are facilities for hospital-based production inspected and approved by the National Drug Regulatory Authority? That's a question. So that's an interesting question. It does follow WHO requirements, and we believe they should be. I don't know if Fiona or
I can speak for Ghana.
Okay, thank you, Yvonne.
Yes, so in Ghana, not only hospital-based preparations, but community-based preparations have to get approval from the FDA. And the FDA ensured that during the pandemic, these approvals were facilitated. So they were working over time. So all you had to do, all the facility, hospital or community had to do was to take it to them, and they would work on it, test it, and then license. With the preparations that are used in-house, once it is not going outside the facility, that requirement is not there. So there is a presumption that in the facility they would use, they would comply with certain basic GMP principles when they are preparing within the facility for use in their wards, and they would have systems in place for that. But once they are going out of the facility, then there is the need for those preparations to be licensed by the Ghana FDA.
Thank you, Yvonne. Friday, you also had your hands raised. Did you want to go off mute?
Yes, thank you very much. I just wanted to chip in from Uganda. The National Drug Authority inspects the hospital pharmacies as well. Since the COVID outbreak, I think there's been focus on inspecting any institutions that are producing alcohol rub or sanitizer. And I think the other point is that the alcohol rub production within the hospital is really extemporaneous reconstitution. So we shouldn't take the lens of good manufacturing practices standards that are required for pharmaceutical manufacturing. That doesn't mean that any necessary steps to guarantee and quality assure should be neglected, but I just thought that needs to be taken into consideration. It's reconstitution, so the hospital picks up a stock solution and then reconstitutes according to, into smaller containers according to their need, according to also required percentages, following the available standard monographs. WHO, United States Pharmacopoeia, CWPAMS also shared one, and so on. And thank you. Back to Chair.
The one that CWPAMS shared is the WHO formulation. Thank you. So there was a question about receiving certificates here. So after the week takes us nicely, once we, after this, we'll send out a link to the recording as well as the short feedback form and short questionnaire. And then once that is completed, you get a certificate through your inbox, the email that you put on that form, on the feedback form. We've been doing that for the last few webinars. And also just to say, there's one more key development we have with CPA, which is a collaboration with the Royal Pharmaceutical Society of Great Britain. There were several webinars which were also run through the RPS and United Kingdom Clinical Pharmacy Association. There were several of them on infections. So those are all available through CPA website. And again, on completing a short questionnaire or question quiz, you'll be able to get a certificate as well. We felt that that's important. When we started to develop the webinars, we're very clear that we will not be duplicating efforts because there are several webinars across the world. And so what we were focusing on are those aspects that we felt hadn't been covered by others. So our first webinar was very much about what resources are available, so signposting people to all the resources that are available around COVID. The second webinar was a panel discussion with pharmacists from across each of the continents and hearing what they were doing within their countries to support and tackle AMR. If you've got any more questions, please contact COVID-19 at commonwealthpharmacy.org. Thank you, Vicky, for that. And except Vicky has got any other comments, we will bring this webinar to a close. And we're very grateful, absolutely grateful to all our speakers. Absolutely, they've done a great job to keep us all on time and to just really share a wealth of knowledge of what has gone on during the CWPAMs, but also how they have supported colleagues both in the UK and across the world, across the 4 countries to tackle COVID. We are still going through a range of stressors with this pandemic, but together and as a pharmacy profession, we truly can make a difference, and we are making a difference. So thank you all very much.
Yeah, thanks Diane, and thanks everybody. Just to reiterate Diane's thanks, it's been a really interesting webinar. I hope you've all enjoyed it. I've just posted in the chat box the information about the collaboration that we've got with the Royal Pharmaceutical Society. So if any of you are looking to really brush up your clinical skills in terms of managing patients who have COVID-19, please head over to the link that I've posted there. I'll also post that out when we send out the certificates, if that's something that will be of interest to you. So thank you very much. I hope we'll see you all very soon, and hopefully there'll be a webinar 4 shortly. And apart from that, stay safe and keep up the great work. Thanks everyone.
Thank you everyone.
Thank you.
Nice to see you all. Thank you.
Vicky, if you can stop the record, I'll stop the record.